Hi, welcome to my YouTube channel once again. I hope you're enjoying the videos. Please remember to like and subscribe to the channel. Today we're going to look at and have a conversation on anxiety. And I'm privileged to be joined by Daniel Ngerema, who is a clinician and a psychologist as well. So, welcome and enjoy the conversation.
And really, what these things are, they don't have that kind of interpretation. When you come in and try to make them understand that you fear cockroaches.
Yes.
A cockroach is a harmless insect. Once they understand that this is a harmless insect, the fear will go away.
That's true.
So making them understand, that is what we call the psychodynamic therapy. Interpreting this confrontation. Confrontation means, okay, we are talking about fearing of insects. Here I have an insect. You may never know. And I bring it like this. I put it on your head. But before you could know, it has stayed in your hand for 2 minutes. What did it do to you?
Nothing.
So after all, you understand, Kube, this thing is harmless, it can't eat me. Kube, it's so small than me. So I can't fit in its stomach, so there is no need to fear it. That's another way of it. And then clarification, clarifying everything about this. You have this kind of fear, and you need somebody to clarify about this. So this is what you get when you go to a psychological clinic, a psychologist, or a psychiatrist, or a mental health specialist will help you understand all this and overcome the kind of fears that you have.
That's great.
That is what we call the psychodynamic therapy. So we can go to the other part of the therapy.
What about the supportive therapy?
And the supportive therapy means like what I was talking about, the reality testing. I was, let's say you are sitting for an exam. The reality is you have to sit for it if you have to advance in education. Then why fear it? Why fear the exam then? If you have to sit for it to advance, and your only goal is to advance in education, then why fear there? That's anxiety. That's just an example of it. And then there is this another perspective of the supportive therapy is that you really need to seek information. When you notice that you have this kind of fears, don't keep quiet. Speak to a person. What you perceive something to be, probably I, as your friend, perceive it differently, and I may help you overcome the kind of fear. That seek advice, seek information about it. The other one is adaptive behavior. You have to adapt to the behavior, to what you fear. You have to get used to it to overcome it. To get adapted to it, you will overcome it. That's basically what it means.
So when you talk about adaptive behavior, then again that now brings me to the other management of anxiety, which is about the behavior therapy. Could you tell us more about the behavior therapy?
Behavior therapy means what you are engaging in, or what the fear that you hold, the stimuli, or the fear, or the how irritable you are, how you react to a certain stimuli by fearing. This reaction I'm talking about is the fear or the anxiety that you get to a certain stimuli. If you have it, that means you are sensitized to have the fear. So in order to overcome this fear, then what we were explaining, the adaptive behavior, And I said you are sensitized to it. It means you have to do something we call desensitization. Desensitization means as you face this thing so more commonly, your fear goes down, and it reduces. And at one point in life, you say, I overcome this. You have been desensitized from that. You have been brought from that kind of... Being sensitized is like you are full of something and all of a sudden it just gets out of you. It's brought down from you. You are being desensitized. You have overcome it. So that's basically what it means.
Before we wind up this conversation, I'll ask Daniel to share with us the medical perspective in terms of the treatments of anxiety. Remember what I've always told you, that you need to seek help and support from professionals, people who know this. And so Daniel, over to you in terms of management, medical points.
Yeah, this is an important part of it, and I say it's a crucial part, but if you have to resort to the medical, to use of what we call the pharmacotherapy, engaging drugs in treatment of some of these conditions, then that means you have tried you have really done your supportive therapy, you have really done what we said about the behavior, you have engaged this client to see whether he can change this behavior without engaging the drugs. Because when we talk about the pharmacotherapy, that means we bring other perspectives into play. That means the kind of things we talk about, the side effects, the adverse drug reactions, they come into play because people are different and these drugs work differently. So basically when we talk about the pharmacotherapy, about the drugs that reduces the anxiety, they are different. I'm just going to mention the various classes of drugs that are involved. So many people abuse these drugs. The reason they abuse this drug is one, because the overuse of these drugs is addictive. Is addictive. That means if you're used to this in terms of pharmacotherapy, the use of drugs in management of especially mental health issues, in this case the anxiety disorders. I talk more about the benzodiazepines. The most commonly used is called diazepam, which is commonly accessible. But I know they are regulated. What we are calling the pharmacotherapy or the drugs uses in especially mental health issues, they are regulated by the government through the Ministry of Health, Pharmacy and Poisons Board, because they are in the Dangerous Drugs Act. That means they are drugs which have to be kept under lock and key, and if they have to be assessed by the people who most needs them, you have to have a prescription from a qualified psychiatrist or a mental health specialist. So basically, and it's because of the things that I was telling you about. They are highly addictive. You don't have. So to preserve them for the people who mostly need them, they have to be regulated. The second class of drugs are the antidepressants. In this case, I know I mentioned about what we call the Complementary or SSRIs. An example we have there is a drug we call fluoxetine. It's used. It has an effect in anxiety. But mostly we use it in a classical case of depression. That's why antidepressants come into play in these. There's others that we call the barbiturates. Barbiturates, a very common drug that is used in our hospitals is called phenobarbital. We use them even in the emergency departments to control seizures and such that comes with epilepsy and such cases. So that is just a classical example of barbiturates which have an effect in these. But for the choice of the use, it's limited to a qualified professional who is allowed to prescribe these kind of drugs. And other drugs that have some kind of effects in this case are antihistamines. Antihistamine. You are talking about Piriton. Do you know Piriton?
Oh, it's an anxiety drug. Everyone runs for Piriton to sleep.
Everyone wants Piriton to sleep, to reduce their anxiety. But in this case, the common drug or the drug of choice that is highly used by our professionals is one we call diphenhydramine. You can also assess it if you mostly need it, but you must have a prescription by a qualified professional. The other drugs that have some effects in this, you know, some of these problems coexist. You may, those guys that you, sometimes we talk of psychosis or schizophrenia.
Yes.
And schizophrenia, you know, it has some kind of stages.
Yeah.
I know it's another topic altogether.
Yes.
But to have these classical cases of schizophrenia, it starts from all these things we are talking about. You are anxious, you are doing what? So in the management, you may find that your professional is, or the mental health professional is prescribing antipsychotics. For example, something we call haloperidol, which is highly prescribed. It's in use. I know most of our professionals prefer that drug because it has instant effects on the condition. But this has also to be enjoined with the other supportive therapy, behavior change, and all that. You must induce that. There are others, especially if you are medic, we call that beta-adrenergic blockers. I know it's another story to talk about the pathways, the beta-adrenergic pathways, the sympathetic pathways, and all that. It's another topic altogether, but there are drugs that play that point. To block some of the stimulation that occurs.
Okay, that's great. I hope you enjoyed the conversation on